Let's talk about dry mouth. You know, it's way more than just an annoying feeling. It's actually a signal from your body. So, in this explainer, we're going to uncover what's really behind that parched, uncomfortable feeling and what it could be telling you about your overall health.
You know that feeling, right? That sticky, pasty sensation where it's kind of tough to talk or even swallow? Yeah, it's incredibly common. But here's the thing we really need to get. It is not just some minor inconvenience. You should think of it like a check engine light for your body. It's a sign that something, somewhere, is a little out of balance. And yep, there's a medical name for it. Xerostomia. It's just a formal way of saying your salivary glands, those little factories that are supposed to keep your mouth hydrated, have basically slowed down or just stopped production. And that is a huge deal. Why? Because saliva is your mouth's unsung hero. Seriously. It's like a janitor washing away food particles. It's a chemist neutralizing all those destructive acids from what you eat. And it's a bodyguard fighting off germs. Without it, your mouth is left completely defenseless. So what is shutting down this absolutely vital system? Let's dive in and start with the things that are most likely to be responsible.
Okay, so the number one cause of dry mouth might actually surprise you. It's not something you do, but something you take. We are talking about medications. And the number of culprits is just staggering. We're talking over 400.
That's right. The source material says there are more than 400 different prescription and over-the-counter medications that list dry mouth as a common side effect. This makes medication the number one cause by a long shot.
And look, we're not talking about some obscure drugs here. These are everyday medications for things like blood pressure, depression, allergies, and pain. It makes sense when you think about it. A lot of these are designed to reduce fluid in your body, and well, that includes your saliva. And if you're on more than one medication, that drying effect can really stack up. Now, the second most common cause is much simpler, and it's something every single one of us can control: dehydration. This is just pure biology. Your body is incredibly smart. When water is getting scarce, it starts rationing it for the most essential functions. And saliva production, it gets put on the non-essential list. So it's one of the very first taps to get turned off.
Okay, so it's not just about what you put into your body, it's also about your daily habits. Some routines that seem totally harmless can actually be major contributors to dry mouth. Let's take a look. We're going to zero in on two big ones here: the simple act of breathing through your mouth, especially when you're sleeping, and of course, the use of tobacco and alcohol.
What's really fascinating here is the contrast. Breathing through your nose, that's like putting air through a built-in filter and humidifier. But breathing through your mouth, well, that's like aiming a little fan directly at your gums and tongue, just evaporating all that moisture all night long.
Now, we do need to talk about a more serious and unfortunately pretty common cause of severe dry mouth, and that's recreational drug use. The impact this can have on salivary flow is frankly devastating. The sources are incredibly direct about this, especially when it comes to methamphetamine. The term meth mouth, it is not an exaggeration. It's this catastrophic perfect storm of extreme dry mouth, intense cravings for sugary drinks, and a total neglect of oral hygiene that can just completely destroy a person's teeth in a shockingly short amount of time.
Okay, moving on. Sometimes dry mouth isn't a side effect of what you're doing, but a direct symptom of a much deeper medical issue.
And this is where it becomes a really crucial diagnostic clue. It can be a primary symptom of autoimmune diseases like Sjogren's syndrome, where the body's own immune system mistakenly attacks its moisture-producing glands. It's also strongly linked to diabetes, nerve damage, and is a really severe side effect of essential treatments for cancer, like radiation and chemo.
So this brings up a really common assumption. A lot of people think that, just like getting achy joints or gray hair, dry mouth is just an inevitable part of getting older.
But the research is crystal clear. That is a myth, a total myth. Healthy salivary glands are designed to work for your entire life. The reason we see it more often in older adults is simply because they're more likely to have the other conditions we just talked about, taking multiple medications or managing chronic diseases. It's a classic case of correlation, not causation.
So, after going through all of these causes, the most important question is, what do you do about it?
First, let's just be really clear about the stakes here. Ignoring persistent dry mouth is just not an option. Without that protective saliva, you are leaving your teeth wide open to decay, you're making digestion harder, and you're seriously increasing your risk of oral infections.
So here it is, a simple 3-step plan. Number 1, become a detective. Take a good look at your lifestyle, your symptoms, and every single medication you're taking. Number 2, start a conversation. Please don't try to self-diagnose this. You need to talk with your doctor or your dentist. And number 3, get defensive. If your saliva isn't protecting your mouth, you have to step up your game with meticulous oral hygiene.
So, what's the big takeaway from all this? That dry, cottony feeling in your mouth? It's more than just a sensation. It's data. It's information. Your mouth is sending you a very clear signal. The only real question is, are you listening?